Hi, this is Pat Iyer, and I am so pleased to be able to introduce you to Dr. Diane Krasner, who I've known for many years. She is an expert in wound care issues and has published in numerous publications, including a textbook well recognized in the field. Diane is going to be one of the speakers at our October 2020 virtual legal nurse consulting conference. We invited her on the panel of speakers because of the demand from previous attendees from the July 2020 conference who said, we need a talk on wound care. Diane, I'm really pleased that you're going to be joining us. Tell our listener, what are the things that you're going to be covering in your session?
Thanks, Pat, and I'm so pleased to be able to present. There are so many hot topics that have come up in wound care during the last year, and that was even before COVID. Now with COVID, there's just so much to talk about. So I'm going to start by reviewing the important information from some of the new guidelines and consensus documents that have come out. The NPUAP changed its name last year to NPIAP to reflect the pressure injury term that we're now using instead of pressure ulcer. And together with several international organizations published a new pressure injury guideline. So I want to talk a little bit about that guideline, what's new in pressure injury. And then also released was a international medical device related pressure injury, which is a hot topic because it turns out that so many pressure injuries that occur in facilities are medical device related, up to 40%. So both of those were really important documents. And then COVID came along. And so many of the skin and wound issues related to COVID have to do with medical device related pressure injuries. So NPUAP released an additional consensus statement on COVID related pressure injuries. And we are busy in our wound community sorting out the differences between COVID skin, those COVID toes and COVID skin differences, and pressure injuries and deep tissue injuries. So this is all going to be really important, especially going forward, to LNCs as they review cases and look for experts to make sure that people are teasing out the differences in the wound etiologies. And in some cases, we're not really sure at this point what we're seeing. Other issues that the wound community are addressing, especially in post-acute care, are just the increased incidence of pressure injuries that people are seeing in skilled nursing facilities and in home care cases, all of which, of course, have the potential to lead to litigation. And the community at large is not quite sure what phenomena are causing all of these pressure injuries and deep tissue injuries. So I'll be looking at those issues, and then I'd like to spend a little time also talking about end-of-life wounds. So the very last meeting I attended before the COVID lockdown was the NPIAP conference in Houston in February, where end-of-life wounds were once again discussed in an effort to kind of come to a consensus on what we're going to call them and how we're going to define them. And in my experience, so much of the litigation that I review as an expert witness involves end-of-life wounds. So I want to review the discussion, talk about the concept analysis that was done at that meeting. And at the end of the day, however, no consensus was reached. So we're still in that funny limbo state where we haven't agreed as a wound community on terminology yet. So, but it's an important issue because so much of the wound in litigation is in patients who are at end of life. So after talking about all those academic things, and I'll spend a little bit of time reflecting on the trends that I'm seeing in the legal cases that I'm reviewing.
It sounds like a dynamic program, Diane, and I know that our listeners are going to want to attend that session and get caught up with what are those current issues that you're facing and will affect legal nurse consultants who are working in litigation with attorneys. You can sign up for this conference at this link, lnc.tips/October 2020 virtual. That link is in the video that you're watching, lnc.tips/October 2020 virtual. There's no spaces after the word October or after the year. October 2020 virtual. Look forward to seeing you there, and be sure to come and listen to Dr. Diane Krasner, who is speaking on the third day of the conference in the afternoon. Thank you.
Thank you, Pat.